If you are drinking your coffee this morning, it might be giving you more than just an energy boost. A new study from the American Heart Association found that drinking green tea or coffee lowers the risk of death for stroke and heart attack survivors. Here to help us break down this study is Dr. Nima Aga Abraham, an interventional neurologist at Baptist Health and a volunteer at the American Heart Association. Good morning to you.
Good morning.
Thank you for coming on. So this is interesting. A lot of us drink coffee and tea in the morning no matter what, but it's good to hear that there could be some health benefits.
Yes, this is a very exciting study, especially for those of us who do like our coffee or tea.
So what does it mean? What does it mean for the average person? We said this is for survivors, but does this affect everyone?
Yes, thank you. And thanks for having me. As you know, as you said, coffee is very common, especially, for example, in the United States, 75% of adults drink coffee. We have other studies in the past that showed coffee or green tea can lead to cardiovascular, less cardiovascular disease mortality. The study here, the researcher basically looked at patients who had a history of stroke or heart attack and looked at the effect of coffee or green tea and followed this participant to see if green tea and coffee had any effect on their mortality. And interestingly, what they found was that after the participant did questionnaire, about 18 years later, they found that people who drank at least 7 cups of green tea had less cardiovascular disease and led to less mortality. And in patients who had history of heart attack or stroke, they didn't find such effect in green tea in patients who didn't have a history of heart attack or stroke. When it comes to coffee, they found that people who had history of stroke and had at least 1 or more cups of coffee, they had less risk of mortality. So just to summarize it, this study showed that green tea can be served as secondary prevention, so helpful to decrease mortality on people who had history of heart attack or stroke, whereas coffee can be served as primary prevention, so can help with people who didn't have a history of stroke and heart attack and decrease mortality.
But doctor, as with everything, I would imagine that moderation is key. You don't just need to drink 6 cups of coffee and feel like you're helping yourself out.
Exactly, and basically their recommendation is moderate amount of coffee can be helpful. Now, we have to be very careful. This is an observational study, so it's not a cause and effect, but at least we know that, like you said, moderate amount of drinking coffee or green tea is not harmful and potentially can be beneficial in cardiovascular disease. Now, I do want to emphasize adding sugar and cream can most likely take away that effect because that can lead to cardiovascular disease. So we're really talking about, like you say, moderation of coffee and green tea or tea without the added elements.
So don't make it too sweet. Don't pour that whole sugar container in there. You got to just do it a little bit conservatively to make sure that you're getting those health benefits. Dr. Nima Aga Abraham from Baptist Health, thank you for coming on this morning. We appreciate it.
Of course, my pleasure, and thank you.